Good morning.
Good
My
morning.
name is Victoria. I'm gonna be nurse practitioner today, and I will do the head to toe assessment.
Okay.
Can you please introduce yourself? What is your name
Yadan Huang,
and what is your date of birth?
November 5th, 79.
Okay, very good. Let me just wash my hands, and I
Okay.
will go back.
Okay.
Okay. So we're gonna do the head to toe assessment.
Okay.
So we're gonna start with vital signs. I would like to
Okay.
check your temperature first. Okay. Okay, so this is gonna be your oxygen, and we're gonna check your temperature. Open your mouth, close. Okay. Okay, blood pressure is good. 115/78, pulse is heart rate 60, and temperature 97.9, and your O2 is 98. Very good. Okay, so this is my garbage. Okay, very good. So we're gonna start with your head assessment. Okay. So the head looks good. I mean, like no any bulb, no skin lesions, everything symmetrical. And if I'm touching, do you have any pain?
No.
No pain. We're gonna check your lymph nodes. Okay.
Okay.
All right. So we're gonna start with pre-auricular. Then we're gonna do post-auricular occipital. We're gonna come to mandibular. Okay. Anterior cervical, posterior cervical. Everything is good, and supraclavicular. Everything. I mean, nothing enlarged, no tenderness. Everything looks good. So now I just want to see your eyes. Okay, it's cornea is pink, no discharge, looks good. Let me take my light, and I will see. I'll check your nose. Okay, so this is my light. I'm checking. Everything looks good. It's pink, moist, no deviation of the septum, and the other one also looks good, and no issues. The lips pink. Open your mouth. I see what is inside. Everything looks good. All no caries. The mucosa is very healthy. No tonsils. Can you show me your tongue? No hypertrophy, no atrophy. Everything good, looks very healthy. Let me see your ears. So I'm gonna check. Visually, it looks very good, symmetrical. No lesions, no, I mean, like any problems with on the skin. So we're gonna pull up and back a little bit, and I'm gonna look inside, and it looks good. Everything, no symptoms of inflammation, no redness, no discharge. Tympanic membrane look gray as a normal. Everything looks very good. Now we're gonna do cranial nerves, and then we're gonna go for down, okay? Further down. So the first nerve we're gonna do is it's gonna be olfactory nerve. We're gonna check your smell, okay?
Okay.
So we're gonna do two tests. The first one, I wanna see the potency of the air. So close your eyes, close your one side of the nose, one side, and try to pass the air. Very good. Now the other one. Very good. Now I'm gonna let you to smell something. Tell me what you smell.
Coffee.
Very good. Now the other side. What do you smell?
Coffee.
So it's intact. Your olfactory nerve is intact. Now we're gonna check your optic nerve. So the first thing I wanna do, I want you to do visual acuity. I'm gonna be 6 feet away from you, and I want you to read the letters on the bottom. What is the letter? What letters?
A, B, C, D, E, F, G.
Oh, no, no. Close one eye. No, one eye was the other one. Yes, I'm sorry. So what do we see?
A, B, C, D, E, F, G.
Yeah. Now close the other eyes. What do
A,
we
B,
see?
C, D, E, F, G.
Okay, now with both eyes here.
A, B, C, D, E, F, G.
Very good. Your cranial nerve, optic nerve visual acuity is fine. Now we're gonna check visual field. Visual field. So close one eye. One eye. I will show you the number on my finger. You're gonna tell me what number. How many fingers do you see? Okay. So how many
Two
fingers?
finger. Two finger.
Okay. Now with the other one. Okay. Close with your hand. Close. Yeah. How many fingers?
One finger. One finger.
Very good. So your peripheral vision is good. Now we're gonna check your pupillary response. Okay. So let me just. Very good. It's not dilated, not asymmetrical. Everything is good. It looks good. So your pupils are good. I mean, reacting to light as normal. Okay. Now we're gonna do oculomotor checking. Number 3 oculomotor nerve. I want you to raise your eyes up, down, left, and right. Very good. Now I'm gonna do trochlear nerve number 4. I want you to close one ear. Yeah, and I will whisper something and tell me what you hear. 1, 2, 3.
1, 2, 3.
Now another one.
1, 2, 3.
Very good. Now with both.
1, 2, 3.
Yeah, so it's intact. Now we're gonna do cranial nerve number 5 trigeminal, which is sensory and motor, and we're gonna try check the sensory first. So when I'm gonna touch it, this is the dull, and this is a sharp.
Okay.
When I'm gonna touch it, tell me what do you feel, sharp or dull? Okay, close your eyes. Tell me what do you feel.
Dull. Sharp.
Okay.
Dull. Sharp. Dull. Sharp.
Yeah, so your trigeminal nerve number 5 is sensory is intact. Now we're gonna check the motor. The motor part, and we want to see any resistance. So you close your eyes, I will try to open, and you need to give me resistance. So it's a resistance. Now open your mouth. I try to close, and also resistance, it's intact. And I wanna check your corneal reflex. So this is, I'm gonna touch just a little bit of your on the tip of your eyes, and I wanna see the reflex. Okay, so I touch it, and she is blank. So it's intact. So now it's cranial nerve number 6. It's abscess, and I want you to turn your head right, left, up, down. Very good, very good. And also I wanna follow my finger. Okay, so I'm gonna look at my finger, up, down, to the side. Just follow my finger, down, back. Very good. It's intact. Very good. Now cranial nerve number 7. It's a facial. So I want you to ask a couple of things. Give me a big smile. Then puff your cheeks and raise your eyebrows. Very good. It's intact. Now we're gonna check vestibulocochlear nerve number 8, and I will check for hearing and balance. Okay, so close your right ear with it, and I will ask you if you hear anything. Do you hear it?
Yes.
Now close the other ear. Do you hear it?
Yes.
Okay. Now we're gonna do Weber test for hearing. So it's my folk. I'm gonna do like this. Put it on the forehead. Do you hear?
Yes.
Yes. And now I'm gonna put on the mastoid bone. Do you hear it?
Yes.
And like this, you hear it?
Yes.
Yes. Now I'm gonna do the same thing from the other side. It's I'm taking the folk. I put on the mastoid.
Yes.
You hear it. Then I put in front of the ear. So
Yes.
canal, you hear it. So your hearing is good. And now we're gonna check your cranial nerve number 9, glossopharyngeal nerve. So what I wanna do, I'm gonna put something on your tongue, and you're gonna tell me how does it taste. Okay? So close your eyes. Show me your tongue. I put something on the tongue, and they tell me what do you.
Sugar.
Sugar, very good. It is sugar. So the taste your glossopharyngeal cranial nerve is intact. Now we're gonna do cranial nerve number 10. It's a vagus nerve, and I wanna check your gag reflex and say ah.
Ah.
So I'm taking the tongue, the pressing. Okay. I want to.
Ah. Ah.
Okay, and if I'm touching on the back, you do gag. Yeah, so it's intact. I look on the uvula. Uvula is on the middle line. It's not deviated to the side, so it looks very, like in a good position. Everything looks very good. And also the swallowing. Can you swallow please for me? If I'm gonna give you a sip of water, if you can swallow. Yes. So the cranial nerve number 10 is intact. So accessory nerve number 11. I want you to turn your head right, left, up, and down. So it's intact. And cranial nerve number 12. It's a hypoglossal. I want you to show me your tongue. Right, left, up, down, everything is fine. So it's intact. So now I'm gonna check all other symptoms down, and we're gonna be done then.
Okay.
So I wanna check for bruit first here and here. Okay. So we palpated the lymph nodes, everything is good. I wanna see the thyroid. Your thyroid, just lift a little bit. Check your thyroid. Okay, and I want you to swallow. Very good. So thyroid is good. Now we're going down. So I wanna check your heart. So it's first I'm gonna check second intercostal on the right side. It's we're gonna check for atria AV for right second intercostal medium intercostal space. We're checking for AV node. Then we're going to the left AV left second intercostal for pulmonic valve. Then we're going down for the third intercostal space for the tricuspid valve, and we're going to the fourth intercostal space for mitral valve. And everything is fine. Then I want you to check your lungs. So I want you to breathe in and out, and on the back, in and out, in and out, in and out. Inhale and exhale. I check everything. Now I want you to lay down. Okay. So I wanna check the bruit, under xiphoid, then iliac, no bruit, and then I wanna auscultate your abdomen, 4 quadrants, all four quadrants. Okay, then I would like to check all the pulses, the carotid pulses, the radial, okay, the pulses, on the knees and your feet, pulses is intact, everything is fine. Okay, range of motions. Range of motions is good. Range of motion is good. Okay. All right. I want to do percussion here. And from the top down. Breathe in. Okay, it's a spleen. And now we're gonna do the same thing. Okay, breathe in to see feel the edge of the liver. Okay, everything is normal. So range of motions of the legs, everything is intact, and the pulses is very good. All right, thank you. So
Okay.
everything is fine,
Thank you.
and I'm gonna come back with the results.
All right, thank
Thank you.